good morning, good evening. Hello to all those who come in. This is the closing ceremony of the Global Public Health Week. You know that the World Federation has run this Global Public Health now in the 6th edition. It's an annual meeting where we really have everyone coming in. It's not only our member associations, but all people active in public health and global public health are invited. And just to give you an approximate view of what happens and the diversity of things that happen, that is the number of languages used around all the activities is 21 languages from all around the world. We have been countries, the number of countries participating is quite over 73 countries now. And we have different types of activities. Like today here, it's a webinar type or training course or in-person meetings or hybrid things. And everyone is open to have its format, its type of meeting. And I think this is the beauty. We ask for everyone coming in. The total number of events this week was far above 100. I have to thank all those who organized, those who participated. I think this is showing how vivid the global health community is. As you know, the topic was peace and health, and we talked about the interdependence of peace, equity, and public health. Now I have the task to do the closing ceremony, and this is a difficult task. You know, if it's such a rich week, what do you do? And I thought, ask two different generations and both of these generations look for people who are active World Federation people. And I was extremely happy to find two people from different generations. One, let me call elderly. It's always, I have difficulties with these words, but a generation, yes, the generation that has already been contributing since years. I say hello to Michael Moore, president from 2016 to 2018, being also the head of the immunization task force since ever, so working with us continuously. And also to mention, he has been co-chair of the Melbourne World Congress in 2017. So you see someone who is with us since the old times until now, always with us. And from the other generation, I'm extremely happy to say that Federica Castellana said, yes, I'll take part. She is a public health expert and a person that really lives global health, I would say. And that's why she is calling in from West Africa for the moment. In fact, she is coming from Italy, Bari, somewhere, nice place, Italy. Her studies already led her through the countries of Europe and others in the world, studying in Valencia, Toronto, Sheffield, Maastricht, to mention just a few. You see, she is global. And probably she will tell more about what she's doing with NGOs and nowadays with the Italian Red Cross in Western Africa. So I thought it is my task to see with two different generations of passionate World Federation people, after such a week with such a topic, and as we close this week, I would ask them, both of them, what is the one idea or insight that has most shifted your thinking about this relationship between peace and public health? And I think I start with the lady and say, Federica, would you go first?
Yes, of course. Thank you so much, Bettina. First of all, for the invitation of being part of this closing ceremony, and also for the amazing presentation. I will say that this is my third Global Public Health Week with the Young Professional Working Group of the World Federation. And I am really happy because I think that the Global Public Health Week every year is an important moment for the advocacy worldwide. It's one of my favorite moment of the year for the old initiative, even if there are a lot of virtual moments, but it's really a moment where everyone around the world, as you said, 21 different languages and having more than 70 countries. So it's really a moment where everyone have a say on global public health advocacy. So I'm really happy. And the team this year, I think we mentioned during this week is quite timely because of the current geopolitical situation that we are living. I think that this week has been a lot of reflection, and I think we can say that the connection between peace and health is more than concrete right now, or more than visible. And this is the reflection that I've been doing, not only because of the week, but also because of my work. As you said, I'm based between East, West Africa, currently, for example, in Djibouti, and I work personally with people that face the consequences of conflict. But for me, the reflection goes beyond, just peace is just the absence of conflict. I think that this is what really I reflected this week. Is like peace is not just absence of conflict; it's really having access to healthcare that not just in conflict, but just in we can say normal situation. That peace goes really beyond. It's human right. It's when everyone actually have the same right and link with health, have the same opportunity to access to prevention also of health. So this is the reflection that peace and health connection is much more visible and concrete than ever. And then peace it just goes beyond the absence of conflict, and we can see and we can experience every day. So this is my message for the week, I would say.
Okay, thank you. I turn to Michael. What is your take?
Well, first of all, the absence of conflict. What a great concept to really nail it. And I think that's brilliant, Federica. I'd just like to acknowledge, because it has to do with past conflict, that I live on the lands of the Ngunnawal people in Canberra, in Australia. And they deserve our respect for looking after the land for 60,000 years and before settlement of non-Aboriginal people, and they've done a great job. But they've also had to put up with significant conflict over the last 200 years, and actually that conflict still continues in many ways. So just building on what Frederica says, I think there's something really interesting. But in my mind, when you asked the question, I went back to the notion of war, and was reflecting on my own time. So during the Vietnam War, because I'm a different generation, I trained in the military and became an officer. But my colleagues went to Vietnam with the United States and fought there in a totally unjust war where we should never have been. I was fortunate that I didn't go, but nevertheless, I saw and watched very closely how things were done and what war is like when you're holding a rifle. And then more recently, and the thing that really hit me was I attended, beginning of last year, a public health conference in the United Arab Emirates. And it happened to run parallel with a medical conference. And I sat down with some medicos at lunch, and one of those medicos had volunteered to go to Gaza. And he was an obstetrician, and said, but I didn't work as an obstetrician because I was also a surgeon. Mostly I was doing surgery. And then as tears rolled down his eyes, he talked about how he had amputated a child's leg without anaesthetic. And it was so moving for me, and it was so dramatic. And then I looked and went, well, actually, in this conflict, it wasn't just those really dramatic circumstances, but actually there was no anesthetic. There were no medicines. Why? Because in effect there was a siege, and which affects the military. So then you go, well, how can public health operate in that sort of environment? And so then immediately when there is a conflict, it dominates, and public health becomes completely redundant. So, Bettina, I think it was a difficult question. I think Frederica's answer was much better than mine, but I think that notion of absence of conflict is so fundamental to public health.
And
Yes,
maybe
please.
Bettina,
Yes,
if I can
go
react.
directly. Yes, react.
Yeah, I think that what Michael said also made me reflect on the fact that it's really important. Like for me, it can be obvious, right? That why we need to talk about peace and health and the connection between peace and health. But then, when there is, for example, specifically a conflict, health lose the priority. It's like this is what I see. This is what I also kind of experience in other people's life, that health and the concept of health really lose the priority in conflict. And this is really why we need then to talk about the connection, and why it is important, to not focus, to not lose the focus on health and not lose the priority on health. And health should be ensured always and everywhere. And this is something that I think is happening, because then, okay, there is a conflict, and we just focus, okay, what is happening, and people just lose the everything, like just not the access, but just then I'm thinking about medication, for example, for chronic people. And so Michael just made me reflecting on how it's so easy that health lose the priority, and that should never happen, I think.
Yeah, yes. And we have different views from history now, Vietnam War. You are in conflict zones as well. Do you think that, given your two experiences together, are we in a moment, I don't dare to say progress, or are we facing deeper, more complex challenges than ever before, like in the Cold War times? You're both on different experiences. What would you say? Is there a change? Are the challenges, if it comes to putting health forward, different nowadays? Who wants to start?
I wonder if
Michael?
I can
Go,
start
Michael.
on this
Go, Michael.
because because I've always felt after the Vietnam War in particular that I was living in a time of peace. But when I started thinking about this topic, I went, well, no, Australia has never been attacked apart from the perspective of Indigenous people. But in the last 200 years, since white settlement, we've not been attacked, but we've felt vulnerable, and so and that was highlighted First World War and Second World War, where we saw ourselves as part of Britain, and therefore were involved in those wars. But with Japan coming so close, and in fact they did bomb Darwin during the Second World War, it was the United States that we formed an alliance with, and that alliance has made incredible demands on Australia. So that's why we're involved in the Vietnam War. That's why it was that we became involved in the Korean War, in the Gulf Wars, in Iraq, in Afghanistan. Australian soldiers fought in all of those wars, along with our Air Force and Navy. So actually, although I was thinking I had lived in a time of peace, I went, well, actually, I hadn't. But nothing had really come home so strongly as the more recent times, with the United States president talking about bombing a country into the Stone Age, with the situation in Gaza, which I found so incredibly appalling. And so through my life, it's never become quite so strong in my mind as in the last couple of years. And even Ukraine, we were providing assistance to Ukraine, but it never felt that it really impacted me, even as a global citizen. And so this has made me stop and think. And the question about health and war then becomes a really, really important one.
Yeah. So I think this Australia not being a battlefield, if the war isn't in front of my door, it's peace.
Yeah.
No, it shows how global we are connected. Just to say RULAC, the rule of law in armed conflicts, counts 111 armed conflicts as of today. And I would love to have Federica coming on to that. If peace is something that can only happen if it's global. I think the example of Australia is quite telling. Federica, you are also in conflict zones. What's your take on it?
Yeah, no, so Michael make me reflect a lot. I'm really like this conversation. I think that there is a very interesting concept that I think is still happening right now. It's like we think that everything is fine until we do not actually experience the consequences. I'm thinking about, you mentioned Ukraine right now, and um, I know there's been like a lot of focus on Ukraine and the war, and it's already 4 or 5 years right now. But right now, for example, the current conflict in the Gulf, like people are more, I would say, aware of it because as a concrete consequences of the life, we can think about the price of the petrol, right? That is the things that everyone is talking about. And so it's like, okay, I'm okay because it's not like happening here. It's like it's far. And I also wanted to connect this to what you said, like we live in more complex. I think that yes, we can kind of say progress, as you said, but I really think that right now we are in a more complex situation because I can mention climate change and all the consequences of climate change, because then again, we forget that climate change is there, it exists, and we actually need to act. But again, it's lose the priority, right? But as a consequences also on the life of people, on the life of the planet and the animals. And then one thing that I really want to say is I think is connected with the perception also is the misinformation and the at the opposite, the bombarding of information that we have right now. And I think this really add the complexity to the current situation because from one side there is all the misinformation, all the way things are described, but then on the other side we are so right get used to receive so many information every day through social media that we are kind of get used on the fact that our facility bombard and it's kind of no fine, but like okay, it's normal. Like this has happened. I don't know how many times since the start of the conflict, and so it's really complex. But I also have the perception of I'm here. It's kind of far until it really gets to my normal life. I don't know if this.
Yeah.
Frederica, I wonder, I don't know if you have the same saying in different languages, but the first casualty of war is truth. It's a very famous saying, certainly in English, and I think that's part of the challenge for us, and highlighted by you in terms of social media and so on, because you know we live in our own bubbles, and the algorithms feed back to us what we look at, and so we wonder, and with that, of course, we also lose trust. And trust is so fundamental to public health.
So indeed, so we do have, in a certain way, a more challenging situation nowadays. And I think as public health people, we love to say prevention, 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 always central. But I feel, why are we not talking about prevention first in conflicts? The root causes of war start very early on. Everybody knew there is a problem in Gaza. Everybody knew where it was. Why are we not acting, or are we acting, or do we understand and advocate for prevention first also on conflicts? What would it take to make prevention politically and socially irresistible? Because that's where we have to start, I think. We're preaching prevention, but if it comes to preventing conflicts, I think we're not so strong. Michael, what would you go if I say this? Would you be on my side, or would you say we can do better?
Oh no, we can do better. But one of the things that's really interesting about public health is the public health paradox. You know, the more successful we are, the less people notice it. So when we have a fantastic program to eliminate measles with a great vaccine and nobody has measles, so it doesn't become important anymore, and people think, well, I'm not going to put a needle in my child's arm because that might hurt them, losing sight of what we have achieved, and even more true with polio. Because I can remember children when I was young, and Frederica, this will be very surprising to you, they wore bars down their sides of their legs with leather straps holding those bars in order to be able to walk. And there were children like that in my school because they had had polio. And you know, polio has almost all gone. There have been two cases only up to when I looked a couple of weeks ago this year, one on the border of Afghanistan and the other one on the border of Pakistan. So, and I think the same applies to when we're looking at conflict prevention, where we
Mm.
have achieved that, nobody knows
Yeah.
because it's not interesting news. The interesting news is that Gaza's being bombed, that one of the American bombs that hit Iran killed 170 children. You know, the war crimes are interesting. The prevention is not. So this becomes a really, really challenging issue is how do we sell those
Hmm.
really, really good fundamental stories about how conflicts have stopped, how diplomatic relationships have worked to avoid conflict in
Yeah.
the first place. And if we go back to looking at Israel, if you have a look at Israel and Jordan, and some of the other countries around where they have actually got diplomatic relationships that have worked,
Mm.
that's what we would like to see.
Yeah.
But instead, what we see are the conflicts. I hope I've answered your question. You know, I spent 13 years in politics of answering questions without answering the question. Now
Yeah.
I'm trying really trying hard to actually answer the question.
No, but it's about prevention. And you said, well, the paradox, and it's true.
Yeah.
Living in peace, we think it's granted. And I think I would love to see how Federica, who came in with our different challenges as to our different ways of communicating, looks at it, how prevention first could be feasible, actionable. Federica, what's your
So I
thoughts?
have yes, I have actually the like my perception of the answer of this. I really think that, for example, this is link and maybe I'm talking, you know, for the young professional point of view, a person that ended a master 2 years ago, and last year I decided that I wanted to study more on global health diplomacy. And I studied in my master also policy and law and public health law and politics a little bit, but I think that from a knowledge, you know, moving from trust to that knowledge from a young public health professional, I would say that to do more on prevention also to conflict and, you know, to then promote more peace, we need also more component of politics and diplomacy in the curricula of our bachelor and then our master. We need also public health professional who understand more the geopolitical landscape, they understand more politics, they understand more diplomacy to then
Mm.
really be able to be in the first front of actually prevent also conflict and then promote peace. So this is something that I think we've been discussing, if I'm not mistaken, last year in the Global Public Health Week about global
Mm.
health diplomacy. And I really think this is something that we need to empower more young professionals to then be able to be there and then use their skills, the diplomacy skills, the negotiation skills,
Yeah.
and the public health skills also in preventing conflict and in promoting peace. This was just
Yeah.
ready answer.
Yes. Yes. It
And
rings a
Frederica,
bell. Yes, please go ahead, Michael. Sorry.
yeah, and Frederica, what is interesting, we had another seminar yesterday,
Yesterday.
and
Yeah.
one of the attendees there raised the issue of courage. So it's about advocacy, but having the courage to be part of and establishing the ability to try and influence government to play a key role in preventing conflict. And I think that's really, really important. And I think, Frederica, what is interesting, we had another seminar yesterday, and one of the attendees there raised the issue of courage. When you're so it's about advocacy, but having the courage to be part of and establishing the ability to try and influence government in public health like that. So it really adds to your incredibly important insights.
Yes, exactly.
Also,
Really good.
I'm just gonna answer. I really think that at least in the generation I see, in the people I work with, like with the young professional working group, and also other organization, I think courage is there. Like I really see the courage. You know, as the working group, we launched a social campaign this week, and we ask you-led organization to then, okay, what is peace and health for you, right? And then we receive videos for a lot of different youth-led organizations of young people actually express and say what is health and peace for them. So I really think courage is there, and sometimes more the means, and sometimes I find that more training and more skills than just give you the end of that courage, you know, like or help you actually be able to then I don't know what to say, but like really focus that courage in something more concrete. So I think the courage
Yeah.
is there. It's just, you know, the next step that is needed.
Yeah. Uh, I think that that's why I wanted two generations here, Federica, and I may continue on what you said right now. We know that young professionals often call for urgent, they feel the urgency, urgent transformation, and they look at institutions or people that are moving, let's say, more cautiously, slowly. So this, I think, positive tension, um, how can it become productive rather than divisive? Some part pushing and others not reacting. Is this tension, or can you share a moment where this tension led to better outcome, where one side is pushing and the other side, coming, you know. Do you have examples for that? Because I think it's very important. That's why I wanted to have two generations here and see how it interacts. Federica.
Yeah, yeah, no, I would say that um, this is I think what we need. We need more spaces where the two generation can actually talk and confront and share the point of view. I really think that is what we need. We need like more partnership within this two generation. And I think that I also learned in my professional life that sometimes, you know, like all this energy and all the courage and we do this and it's an urgency, we need to do this, but then you have on the other side the other generation say no, but there is all this bureaucratical procedure that you need to follow. This is how it works, and then it looks from this perspective a little bit of frustration, because it's like, so you're not taking for serious, you know, what we are saying, or it's not a priorities what young generation want to say. So I think that this is the kind of tension that you were mentioned, and sometimes it's just really look at the two different points of view and create partnership. I really think that the partnership are what we need, partnership between the generation and spaces where we right now, me and Michael and you, we are talking and discussing around this important topic. And about the moment is a bit difficult to reflect on a moment, but I think that um, for me, I experienced last year, for example, I'm just thinking this during the World Health Assembly when we were actually together inside the Palais. I had that amazing experience, and for me, I had the opportunity to support an association that is part of the World Federation in reading a statement, and I think that for me was kind of the two generation collaborating together, because I was there as the first time inside the Palais, representing the Young World Federation, and together we were actually supporting each other, following the agenda. Okay, what is the best moment to read this statement? It was actually an important statement of the effect of nuclear war on public health, if I'm not mistaken. And this is just a moment, a practical example, but how different generations were in the same spaces, in the same global fora, but really support each other on, okay, we are here, we are ready to read the statement, we are ready to raise our voice. And it was useful for me because you and the other people and this person was actually helping me in understanding the procedure, and was the point of attention, and I was there, I was learning. And so I think that we need this space, we need this really learning moment, and spaces where we can really discuss and learn.
Well, Yeah, that's true. I remember that you were reading out together with our colleagues, IPPNW, the
Yes.
International Physicians for the Prevention of Nuclear War. I think, again, very timely today. So, yes, we will see what we can do. This World Health Assembly, just to let know everyone, we have an official side event on the Global Health and Peace Initiative, supported by 4 important member states. So I'll try to invite everyone into this official meeting. So you will see we continue. And I think it's nice that you say the collaboration helps getting our voices up. But also, Federica, you talked about the influence of the communication via social media and that. And we see a lack or a loss of trust, even in health systems. It's under strain globally, not only in the US. And we all get different generations approach trust building differently. And what do we have to do around the world to restore credibility of health, of us, health people who are doing vaccination? I mean, Michael is head of our immunization task force. Vaccination worldwide is under attack. A lot of simple health issues that you're dealing with are looked at as no longer trustworthy. How would you think we could work together, collaborate there? It's both to you, Michael and Federica.
Michael, do you want to go first in this?
Sure, if I'm invited to. Thank you. Let me build a little on what you said first, Frederica, and it seems to me that I often hear people say, "Oh, the younger generation." I have exactly the opposite point of view. Maybe I've just been lucky when I was a school teacher in my first career, when I was in politics, and I dealt with so many people in different generations, and I've always had exactly the opposite perspective. I am taken back in history because I know, I'm trying to remember where the quote came from, but I know it was from Rome, with one of the famous authors in Rome complaining about the next generation and how terrible they were. And so I think it's been a standard thing
It's
for the
recurrent.
last 2,000 years or more, yeah. But my experience has been similar to yours, Frederica, that when I work with young people, I'm so excited. There is a difference, I think, in terms of how quickly you would like things done.
Yeah,
And so when people
definitely.
talk, when I was in the CEO of the Public Health Association of Australia, and we were talking about vaping and
Mm.
taking action on vaping, and in fact, I published a paper on vaping back in 2016 or 17 about what we should do. Um, but I've always said it really takes 10 years for us to implement policies, and it can take even longer. So I'm going to take a step back in my own history. When I was first in politics, I got involved in public health through work on prostitution and illicit drugs. We were able very quickly to get legislation on prostitution, to legalise prostitution in my jurisdiction through. The legislation remains, it's cited as being very forward thinking. My legislation on illicit drugs, we got some through, but it's only 30 years later that it's really, if you like, got where I had recommended, where I wanted it to be. Even more interesting, I think, is I introduced Australia's first legislation on voluntary assisted dying in 1992. We've only just introduced it in my jurisdiction now in 2020. It was in 2025. Sometimes we can do things quickly. Sometimes they take forever, and so that was when I perceived I was a young man. Actually, I still feel I'm a young man until I look at my picture on the screen, and sometimes it's very difficult to be patient when you know what a difference you could make in people's lives, and I think that the collaboration you talk about is absolutely fundamental. Some people talk about mentoring, and I think mentoring has a role, but it also transfers power from the mentee to the mentor. However, most mentors I know build up a really good equal rapport with the person who's learning, and I think that's also important. And so there's so much to be done, and the reality is I can't do this so much longer, depending how you define longer. And so I look forward to your generation, people like you, and there are many of you who are already making such a significant difference.
Yeah, thank you, Michael. And perhaps Federica, you want to react?
Yeah, because again, a lot of reflection. But I think that at least my perception is that I'm going to use the general for young generation, young professional. We really want to know, like, it's like we are thirsty of information, like it's really, we want to learn. And this mentoring that now you mentioned, I had mentors, and in the last couple of years, I also had the opportunity to be a mentor for student of the master that I pursued a couple of years ago. And I was at the opposite side, right? And for me at the beginning, it was like, okay, I'm gonna do, because I really want them to do this experience and to see how it feels. And on the other side, so this even younger people, asking question and want to know, and then how it is in practice, and so what can I do, and all of these questions. And then I realized that those were the same question that I have, the same question that I ask also my mentor. And so it's really like asking and wanting to know how also we as the young professional can do better, and what can we do better. And this is linked with the partnership and the point of view that I was saying before, because I think that sometimes there is tension, what I was saying, but then I think that there is this collaboration between the two generation. And I really think that the two generation can really support each other, like, okay, give me the information, you have so much experience, I want to know. But on the other side, it's like, okay, this is my point of view, this is what I am experienced, this is, like everything that we are living. And so I'm telling you so that maybe you can, we can support each other to move the topic of the agenda, we can say generally, more forward. But what Bettina also said about the trust, I really think that this is times also there is a lack of trust between the two generations. And so this is why I think that communication and partnership are really useful for this trust moment. And I also think that this is linked then with the global community. So like this trust is also because I think that the way of communicate, I think it's a bit change. Like we mentioned social media. Right now we have all of this information, and I think that we really need to, again, support each other, the new generation, to see how we can best communicate. And maybe that is also my approach. I really think that we need to put our face out, we need to show, because I think that right now trust, it's linked with transparency and accountability even more. Like a lot of people, like, okay, it said that I trust this person because it put his voice, and so it become more transparency, more accountable. And so I really think it's all interconnection. But sometimes this relation with trust of, for example, public professional and the public is really linked also with the same concept of trust between the two generations. That there is a way where the communication get lost, where when people misunderstanding, and I think that we need to be there to build again that communication, to find a way of actually like reaching the community and building the trust, because trust is the first things. We cannot lose trust in the community, and we cannot allow community to lose trust in public health.
Yeah,
And
thank you.
if I very quickly say, and that trust is really important in recognizing the mistakes we've made, so that you don't make them, so that you don't make the same mistakes. And it's a trust for us to say, yes, we got this wrong.
Mm-hmm.
Yeah. And that's an important thing. I think what you both comes through is the collaboration, but also the learning on both sides. If you say mentoring, we always learn from others and through other experiences. So I think this is a very good point. But I also come back to Federica. You have mentioned very quickly the word climate change, and I know that we have to make sure that today's public health decisions or political decisions do not compromise the health and peace of future generations. And this is especially, and youth has been very vocal in the context of climate change. You mentioned it, climate change being involved in migration, resource restriction, and so forth. And there, young move and war, yes. And young people have been really out with Fridays for Future and other things. I would like to have your reaction on this, because you mentioned climate change just as one of these very heavily interlinked issues in public health and public health decisions nowadays, you know?
Yeah, no, I think it's I'm actually thinking of a lot of different link to this question, because as I said, I then think that it loses priority as health then loses priority. I know that, for example, the past couple of days, if I'm not mistaken, was the 6th or the 7th or the 7th or 8th. I don't remember the exact date, but as part of the G7 presidency, France actually organized the One Health Summit. And that, I think, has been an important choice linked then to climate change. As we know, the One Health is one of the approach that connect the environment and the animal and the human. That is one of the approach that it's on the front then for facing climate change. And I'm thinking of then how it's gaining more importance globally. And I really think that youth as they have a role in this. And last year, for example, we were, me and a colleague from the Young World Federation, we were able to be part of the IPSF World Congress, the International Pharmaceutical Student Federation World Congress. And we were actually talking about One Health and climate change, and we were organizing a workshop with all the these young pharmacists all around the world, and see, unfortunately, how there is still a lot to do, and we were trying, to mobilize, and we in this workshop, we were thinking of what could be the project that young people could do then to advance intervention and activity for climate change. And I remember that in just 1 hour of workshop, this group of young people came out with such amazing solution, and also community local based solution, really complete solution. And so it made me reflect that the ideas are there, and the young professionals are there. And we need to have more space. I will just push for that. We really need to then bring those solutions to global fora. And I also want to connect that with the World Congress in public health that the World Federation, in collaboration with FASA, is having in September in Cape Town, because One Health is actually one of the topic of the different plenaries. And so it's like we are talking about it, and I think it's really important. And as a young professional, we submitted 2 abstracts on AMR linked with climate change, and we wanted our voices to be heard, and then show what young professional can do. So there is a lot of space. It's just to find the place where young professional can show it. And I'm happy that I can see actually progress and improvement in that. So I see that there are a lot of activity, a lot of ideas. And we have in the Young Professional Working Group, the AMR committee that is working a lot on climate change, on research, on policy. They organized a webinar a couple of days ago. So I really think that this is one of the topics that young professionals have the voice, and they are doing a lot. Because I remember I did for my master thesis was on climate resilience. And I remember I did this interview, and one person tells like, yeah, it was linked with policy, European policy. So it was linked with the climate resilience and the European policy. And then this person told me during the interview, yeah, we are doing a lot. We're talking about climate change, as people think that climate change is happening in 20, 30, 50 years. But no, climate change is happening now. It's urgent now. If we want actually, carbon neutrality in 2050, we need to act now. And I really think that is one of the area where we need this intergenerational partnership, because we need to act now. And I really think that young professionals can bring a lot to this.
Yeah.
One of the topics. That one
yes,
too.
Please, yeah. Michael, yes, yes,
You know,
please.
I'm just agreeing with Federica. We need to act now, and we
Yeah,
are
and
all we are all acting, but we also see the forces that drive us backwards. You know, when we have the US president say it's a hoax, all the work that had been done leading up to and under the previous president, which had been excellent work, uh, understanding the urgency, and then boom, it all gets turned backwards because of money from oil.
yeah, I think we see a very urgent, and we are looking at backwards movements. So, um, what can
Bettina,
we? Yeah, you
yeah,
wanted to come in?
if I can react with what
Yeah.
Michael said, is that, and this is why then we need this collaboration, because young people are ready to then, be in protest, to then be there and do activities and project and raise the voice, and then who is, making decision? Unfortunately, it's another generation, and so I really think that this is why we need the support among the generation, because then it happened that there is the current president of the US just say, okay, climate change maybe does not even exist. So it's like, this is why we need this collaboration. Like, exactly because this happened, and we need more voices. We need, like, in this, I would say that courage, and the speed that maybe we can have. We want everything faster. Like, I think this is where we can push, and we need then the other generation supporting and facilitating this.
Yeah.
And you touch on a really important generational difference through my studies, through what I've been doing up until even less than 10 years ago, when we presented evidence, always with anecdote to help influence, but we presented evidence, it was accepted as evidence. Whereas now, even if you do look up something through ChatGPT or something, it's actually relying on what has been put on the internet, which isn't evidence. And so
Mhm.
there's a really big difference between the way we see the world, and we're having to ourselves to shake up and go, wait on, because we are used to seeing information that's evidence based and using information that's evidence based. And now we have to counter acceptable information that's simply got no evidence behind it at all, and invariably is contra to what the evidence says. And that's something new, that's something frustrating, and something that we do need to try and learn from each other.
And also to add this, like, I think that this is why also, as I said before, I know the AMR committee, it's also working on research. We have young professional in our working group that is also working on research and produce also the evidence from a young perspective, and so that can then, like, support and complement the evidence that you've been working with. So I really think that it's the same approach. It's just, I think that then we have, as I said, more complex situation, and this is also given by the misinformation, as you also said.
Yeah. So if I listen to both of you, given different perspectives, but where do you see strongest alignment, where we can really be together between generations, between countries, places, in advancing our issue nowadays, peace for health, health for peace? Where should we really be strongly aligned? Who
Your
wants
turn
to?
to start.
You start. You start, Michael? Oh, who
No, I
wants
said
to?
it's Frederica's turn to start.
It's
Okay,
okay,
okay, my
Federica.
turn to start.
Where
Okay,
should
good.
we be together for our topic?
Yes, yes. Uh, I think we come back to what we said before. We should really be together in promoting peace, like, and like promoting health and promoting peace hand to hand. Like, we should really be together in communication, and in making this promotion, like from health promotion and then peace promotion, and bring this together. I think that as Michael said, and you said at the beginning, like, promotion has been and is, it's still, the core of public health. And I really think that we need to be together in the promotion of peace.
Mm.
Michael,
And
as good as answer.
Yeah,
What do you
I,
no,
think?
no, no,
yeah,
no. We're overlapping beautifully. One of the things that's very interesting to me, I spent 10 years as the CEO of the Public Health Association of Australia, And I just looked back today to look at the policies because there's over 100 policies and they're reviewed every 3 years. There's not a single policy on public health and peace. All those policies. And for some reason, it it hasn't been in our mind. What a disaster that is. And
Mm.
what a failure on my part. Because I was responsible for that for 10 years, and really feels quite frustrating. The good news is the people who are there now, who have so many ideas, are perfectly capable of coming up with a brilliant policy, following these sorts of discussions and going, yes, of course, we do need to work on this issue. And so, out of a frustration also comes an opportunity. And it's something that, as I was saying, we have to look at our mistakes and hopefully the next generation can help correct them.
Yeah. So we could be aligned of getting people aware of the very close link between health and peace, because I have seen that not everyone is aware of the fact that health, even of generations, mental health of third generations will be impacted by conflict and war. So
Yeah.
I think it's good thing we can do together on all sides and get this awareness higher up on the agenda. Yeah, I think that's it's a good message. I
Mm.
would keep. We are coming quietly to the end of this closing ceremony, the hour, and now comes the classical difficult thing at the end. That's the question to both of you. If you could leave our global public health community with one bold, actionable priority for the next 10 years, let's say, what would it be? And who needs to act now? Because we feel this urgency. We see it in front of our eyes every time we open the news. And what gives you hope that this could be achievable? We want to have achievable goals. This is the question that I think is important for all of us. And I wonder who of you both wants to go first.
I'm happy.
Good.
Um, I would say that the first and most important part is consolidation of what we've achieved. And that consolidation means not going backwards. And let me use a couple of specific examples. One of the great achievements of my era was getting a tobacco policy under control and bringing down the rate of smoking from up to 70, 80% of people smoking down in Australia. When we look at our teenagers, 12 to 14, we were down to 2% of 12 to 14-year-olds who had ever tried smoking. And so we're sitting there with our success, feeling that we're okay, when the tobacco companies introduced vaping.
Mm.
And we now know from more recent papers, vaping is not so different in terms of the damage it does from smoking. But now we're talking about 6 to 8% of that same age group who have tried vaping, which the tobacco companies try to sell as, oh, we can help you stop smoking if you
Mm.
change to vaping. And it was always a con, as they've conned so many times. So how does the next generation look and go, how do we at least consolidate the policies where we have achieved things, remembering the public health paradox? We try not to look at those things. And how do we make sure that we continue with our good work and learn from the past? And when I hear people talking about COVID, they tend to focus on the lockdowns and some of the more unpleasant aspects of those, forgetting that there are 180 million lives saved, and to look at the positive outcomes. That is part of the paradox. So, to answer the question specifically, consolidation and making sure that we're not going backwards at the same time as going forward with the new advocacy work around things like climate change and health, elimination of conflict, and so on. So that would be my take-home message for the next generation.
Yeah, okay. Thank you, Michael. And now I'm turning to Federica.
Right. Yeah, I think it's definitely not an easy answer and an easy thought because we live in uncertainty and I reflected I reflected I'm reflecting on the answer, but then what Michael said really I think it's right when you talk about like consolidating and then before you're talking about evidence and policy, and I think that one actionable like measure or activity that we can do as young professional, but then again in collaboration with other generation, maybe could be really support in producing more evidence on the link between peace and health. Like be there and give also like in the evidence the perspective of our generation to then guiding this policy, to then be able to then, as Bettina said, putting this topic in the agenda. We know that policy, that evidence then move and support putting this topic in the agenda. And so as a young professional and this generation, I think that we can really support in producing this evidence to be sure that health and peace is then become, as Michael said, like policy and in each country and is then build on the work, as Michael said, that has been done and the work that has been consolidating. So we really connect what Michael said. I would say we should and we can support in producing this evidence to then bring health and peace high on the agenda.
Oh, thank you. Thank you so much, Federica and Michael, because I see positive messages. I see actionable things that we're going to do. And I would like also to again invite all of you to what you said, Federica, the places and the moments where global health diplomacy is happening. The first meeting will be the May World Health Assembly. I'm looking forward to receive proposals for statements from all, and especially I've seen there's already things proposed by young professionals. And please come back to me if you need any help. But we want to be extremely present at the World Health Assembly, both on the World Health Assembly, but also on this official side event that will happen on Thursday, supported by 4 member states on the Global Health and Peace Initiative. So that's where we have a meeting point to make actions and also have, which I think is important, the link to member states, to governments that are present in Geneva, very good possibility. And then the next, I would say, meeting point is, and has been mentioned by Federica and Michael, is our World Congress in Cape Town, September 6th to 9th. I hope to see a lot of you there. And this is the moment where we, on one side, exchange as a global health community, but also meet with people who have been active in the things we have been discussing today. I hope to have, for example, as a speaker, Francesca Albanese, which is a person who has been active in the health and peace and the peace discussion in a way that is courageous and has a voice. We will also drain on, and you are now based in Africa, Federica, a lot on our African public health associations. We hope to see a lot of them present and also some of their political leaders there. I hope to have a diplomat who solved a conflict between 2 African countries, Botswana and Namibia, without war, just by going to the International Court of Justice. I want to have someone explain how diplomacy worked in a real world case. So I hope that we will meet all in these 2 places, all those who can come to Cape Town. I know traveling is not easy for everyone, but I would like to invite also people online to think of the two possibilities. And by this being said, my thanks go to both of you, Michael and Federica, having taken up the challenge to be kind of opponents, but at the end we saw it's a collaboration between, what did you say, Michael? The platinum beard? Platinum
The
beard?
platinum beard. Yes, yes.
Platinum beard and the dark hair of Federica. I can only say a big thank you to both of you. And a thank you to those who followed us now and will follow us online later on. Thank you so much. Have a nice day. And thank you for being with me.